So in the urogenital examination, we have to, first one is the pelvic region examinations. So here, before starting the pelvic region examinations, we have to explain to the patients, so what we are going to inform, what we are going to do. So that one we have to say, so at this point of the physical examination, I'm going to examine your pubic area, genitals and prostates. So if you explain to the patients, the patient is going to be comfortable. So in these positions, so this portion of the exam should only last 5 to 10 minutes. And also it's very important because of many disorders are associated with the part of your body. So it's called the groin region and also pubic regions. So if you explain, so what we are going to check in these regions, so the patient can easily understand. And also in addition to multiple prostate disorders, testicular cancers, there are many other disorders, diseases in the male genitourinary systems are going to be identified after assessing the pubic regions. So which if caught early, so treatable and also may prevent the future pain and also grief of you and also your family. So that means if you are explaining in this manner, so I'm going to examine your groin region, the pubic regions. So if we examine these pubic regions, maybe we can detect any prostate disorders or any testicular cancers we are going to identify. So if we identify early, so we can prevent and also the treatment will be also easier, and also we can prevent the serious complications regarding the genitourinary systems. So if you see, for example, any testicular cancers, in the testicular cancers, normally we can find any lump in the testicles, or this associated with the lump and also lower back pain, and also any pain in the scrotal regions, any pain in the groin region, and sometimes also going to be associated with the swelling in the breast in case of the gynecomastia. So may chance to get all these signs of the testicular cancers. So while examining the pubic regions, so we have to understand about we have to think about these signs. So if anybody tests swellings or backache or any pain in the scrotal region and inguinal region, so if you understand about what are the signs of the testicular cancer, while examining, we are going to concentrate on these particular important points. So these things, if we examine, the patient also going to be cooperate, and also we will do our examination completely. And also we have to explain, I'm going to look for any lumps or bumps, anything in the out of the ordinary. So that means, so we are going to place our hand on the scrotum, so and the pubic regions. So we are going to explain about so we are checking for any swelling, any lump in the scrotal regions, the groin region. So these are going to be explained about any testicular cancers. And also there should be no pain associated with this portion of the exam. So we have to explain. So while examining, you normally it won't get any pain. But if you feel any pain or any tenderness, so we have to ask them, please let me know any pain or tenderness. So according to his feedback, according to his response, so we are going to examine further. So we are going to check any swelling, any lump or any lymphadenopathy. So we are going to identify. So if you explain clearly, so the patient also going to be feel free, and also he can ask so many questions, and we can proceed the exam further. And this in the pubic regions, so what we have to examine, we have to look for any skin disorders, and also any edema, any swelling, any masses, any ulcerations, or any infections, or in case of any warts or lesions, we have to examine. So you have to check in the groin region if the patient should be in the comfortable positions. So we can ask them to remove his pants, and also there we have to examine any skin disorders. So if the skin disorders related to what type of the disorder, is it fungal disorders, is it bacterial infection? So we have to identify. Or in case of any edema, or maybe is a swelling or any lumps, so we can identify. Or in case of, we have to check for any scar formations. So in case of if anybody having scars in the inguinal regions, so we have to check for the inguinal scars. So we can suspect if anybody having scar, is there any in the prehistory of any surgical procedures, such as any hernias in the any inguinal hernia, or maybe in the any abdominal hernia or femoral hernia. So different type of the hernias, so may chance to get. So because of these hernias, are they undergone for any surgical procedures? So have to check. And also in case of any other any abnormality in in the pubic regions. So such as like any chancres in the primary syphilis. In case of syphilis, so they may chance to get the abnormal like a enlarged the skin infections, or maybe is going to get the ulcerations on the in the penis or in the groin regions. And also in case of any other like incisions in the inguinal regions, so especially for the any hernias or any other surgeries. And also have to check, evaluate the amount of and also distribution of the pubic hair. So you compare the Tanner stages diagram for the adolescent development. So if you know the hair, like a pubic hair development, so how is the distribution? So many types of the like a distribution is there. So according to the distribution, so we can know the progression, the growth of the adolescent or adult, or is maybe child. So how is the hormonal imbalance, or how is the balance, how is the development of the sexual characteristics. So we can evaluate according to the pubic hair distributions. So the pubic is going to be like a triangular or maybe rectangular. Some more hair is going to be in the penile regions or testicular regions. So depends upon the distributions, we can understand the development of the sexual characteristics. And also if any any skin irritations, or maybe any if you see in the pubic hair region also, if it is not maintained proper hygiene, so they may chance to get the any like a worms, like a lice, and also exocorneations, or maybe any abrasions in the skin regions. So we have to identify all these things in the pubic regions, so that how to examine in the pubic regions. So according to the involvement of or observation of these findings, so we can suspect what is the causative factors for the for the problems. So in case of any ulcerations, or maybe any scar formations in the penis also, in case of any circumcisions. So in the circumcision also, we have to find is how when it happened, the circumcision, it's the recently or in the longer time. Sometimes if not healed properly also, the scar formation is there on the penis. So these things we have to identify during the examinations. And also in the pubic regions, so we are going to place our hand. So here we have to explain. So I'm going to gently roll my pads of the fingers and tips along your front of the thigh, your hips. So we have to place our finger pads over the front of the thighs, and also hips and lower abdomen, to evaluate the size and number of the lymph nodes in the area. So we have to identify. So if we place over the inguinal regions, and also in the upper and also lateral and also medially, we examine these things, so we can identify any swellings or any enlargement of the lymph nodes. We are going to identify, so by placing and also while palpating with our finger pads. So here I will also be pressing the area for the masses, so which could be evidence for hernia. Please let me know if you feel any tenderness. So if you explain clearly to the patients will cooperate, and also you will give the feedback. Okay, I'm getting the tenderness. Maybe I'm not getting any pain here. So maybe I'm feeling some numbness. So he's going to be explained. So these things are going to be gives the clues about the hernia. So the hernia is nothing but is abnormal displacement of the intestines. So sometimes we are going to find the different hernias. So abdominal hernia, epigastric hernia, femoral hernia. So many things we are going to be identified while assessing the pubic regions. So here, if any, we have to check for any mass or any tenderness, and also enlarged or immobile nodes. So if anything, if we palpate with the hands, so we are going to find any nodule, any masses, so are any lymph node enlargement. So we are going to found during the pubic regions. So we have to examine the upper groin regions and also lower groin region in the suprapubic regions. So all regions, so we have to assess and we have to find out any abnormality in the groin region.